All right, this is an instructional video for taping an NG or an NJ tube. If you don't have a bridle option, many times infants or neonates, their nasal passage is too small to fit the bridle and the tube in, so we end up taping them. So the things you'll need for this is a Sharpie marker, a pair of scissors, Mastisol, it's a pre-adhesive, this linen tape, I call it hockey tape, or I actually prefer steri strips, and I like the 1/4" steri strips, and a duoderm that goes on the skin before all the stuff, and then a tegaderm last. This is a baby tegaderm, or a small one. If someone's allergic to tegaderm, you can use IV 3000. So that's a good one to use. It's a very similar product, it just has a little different adhesive and can help if someone's allergic to that. So we start with the Mastisol. Comes in this little applicator, and you just break it, and then you want to put that wherever you're going to put the tube. I put it on the upper lip and both cheeks, and on the tube itself. Anywhere the tape is going to stick, I put it on there. So upper lip and then both cheeks. And then this stuff works by being dry, so you can fan it dry or you can pat it dry with washcloth or something like that. And then we want to take the duoderm that I've cut in half, and we just put a little bit on each cheek. That's just to help protect the skin. Sometimes you'll get a nurse or someone in the NICU who will not be cool with you using Mastisol. And that's fine. You can, of course, not use it, but it really helps things stick, and it's relatively safe for the babies. We would use it on open wounds to get steri strips to stick on post-surgical cases, so it is absolutely safe. Okay, so once the duoderm is on there, I put some more Mastisol on both sides. Let it dry. And you could either use this tape and just, you'd want to tear two pieces that are about 6 inches long, and then you want it to be nice and skinny, so I just end up splitting that in half. And then you can use both of those pieces, or you can use 2 steri strips, which is what I'll actually use. They do a really nice job of gripping, so you just get the steri strip out. And what you want to do is start on the opposite side that the tube is on. So you stick it on that cheek, put it right on top of the lip, and go right over top of the tube. At least once. Sometimes I wrap it twice. You want to make sure you have enough of a tab that it sticks it down. And just want to make sure that that sticks nicely like that. And then a little more Mastisol on top of this. I take another steri strip and put that right on top of the other one. And then I go over that little loop here, and I try to tack it down to the cheek so that nothing can get in there, a finger or whatever, and pull the tube up. And then the last thing you want to do is the tegaderm, or IV 3000. Cut it in half, and we put a piece on each side. And notice that I have the tube sort of directed towards the ear. It's sometimes nice to just hang the tube over the ear once you're done. And then I put a piece of tegaderm on the other side as well, just to keep that from getting loose or getting stuff all over it and peeling up. Just helps preserve that. And be careful you don't close eyes, ears, or lips with the tegaderm. And then the last thing I do is make a little reference mark right where the ear meets the head. And you can say I already did that once there, but that's just a reference mark so that if the tube gets pulled, you can tell exactly how far it's been pulled or migrated, because many times it's still in a good spot. So that's the way to tape a tube, and usually it won't come out. You can wrap it around the ear and pin it to their gown or what have you. Usually a piece of tape around the tube and then safety pinning it to the gown helps. If it gets accidentally pulled, it pulls on the gown instead of on the nose. All right.